Hi, I'm Andy Bell. I'm Deputy Chief Executive at Centre for Mental Health, based in the UK, and really delighted to be part of this conference in Australia for Equally Well. We've set up Equally Well last year in the UK, which we're really proud of. Centre for Mental Health is an independent charitable body set up 35 years ago to improve mental health for all here in the UK and to reduce inequalities in mental health by using evidence to change policy and practice. And there's nowhere where that's more important than in the physical health of people who are living with a severe mental illness. We all know that the statistics, they're much the same in the UK as they are in Australia or indeed New Zealand and many other parts of the Western world. And we know how important it is that we all take collective action to make a difference there. We really came to Equally Well through a couple of routes, one of which was that in 2016 the Academy of Medical Royal Colleges here in the UK published a report looking at inequalities in physical health for people with a severe mental illness, and they really identified the need for coordinated national action to bring a change to the very unequal outcomes that they were experiencing. And at the same time, there was a major national policy called the 5-Year Forward View for Mental Health in England, which set about a major ambition, particularly to improve people's physical health by extending access to physical health checks for people using mental health services. We were very fortunate that Helen Lockett, who worked with us before she moved to New Zealand, came to talk to us about the work she was doing there with Equally Well, and we thought, this is one way in which we can help to make a change there. And we've been incredibly fortunate that we're now able to do that, or at least we're at the start of our journey, a little bit behind yours, and about 4 years behind New Zealand. So our approach has really been to take the three core principles that we've identified and been inspired by from the work that Helen and Russell are both doing. The first is that improving physical health is got to be everyone's business. It requires collective action, it requires everyone doing something, but no one organisation, no one individual can do everything. It really does require everyone to play their part. Secondly, the importance of co-production. That it's really, really crucial that the answers are brought about by the shared actions of people with professional expertise and people with expertise from lived experience. And we've found that there's huge value in bringing together the understandings of clinical experts and experts in other areas of the professional world with people whose expertise comes from lived experience, either as a service user or a carer. And the really interesting insights come when you bring those together and you create a really kind of three-dimensional picture. And then the third one is there is a huge amount of wisdom out there. All of the solutions we believe are being done somewhere by someone, but they're often really isolated, and they don't necessarily know what's going on anywhere else, or no one else knows about the fantastic work they're doing. So our aim is to make sure that people are able to share their ideas and insights and understandings and bring about change by growing that knowledge from the field. So we're a small organisation at Centre for Mental Health, and we wanted to make sure we did this collectively, and so that's the principle we started with. We joined together with Rethink Mental Illness, who've been really flying the flag for this issue for a long, long time, and they bring together a lived experience group who contribute to Equally Well. From their perspectives, we brought together Kaleidoscope, who are a fantastic social enterprise, who are great at building networks and bringing people together to find solutions to problems. And we're working with the Royal Colleges here, particularly the Royal College of GPs and the Royal College of Psychiatrists, to draw on the very best clinical expertise. We're now building the membership of Equally Well UK. It's just starting. We've got 50 plus members already, and it's growing by the week. And we're really excited by the range of organisations that's joined us. We've got medical organisations, we've got mental health organisations, we've got housing providers, we've got user-led organisations, charities, all sorts of people who want to make a difference and be part of this movement. And in order to join us, they all sign up to a Charter for Equal Health. It's a document that sets out in one page the principles that we all agree on and the ambition that we all have to bring about more equal health for people with a severe mental illness. And we're building resources to help make that happen. So this really is about something for something. We're creating a website, which has research updates. We're providing people with data, we're producing blogs from lived and professional experience. We're creating a learning network which has events which will bring people together during the course of the year. We'll have webinars, and we're really wanting to influence system change as well. And we've been really lucky that so far we've seen some major improvements in terms of policy and indeed research as well, and things are really beginning to happen. So we've learned a lot already. We've got lots more to learn. We want to learn from Australia and New Zealand, and hopefully this international movement we're creating of the equally wells will help to bring about change for people across the world living with a mental illness and create equal health and make sure we can learn from one another. Thanks for listening.